and welcome. You're watching Health and Wellness Myths and Facts. I'm Soro Nirotra Kapoor. The pandemic has put mental as well as physical health and wellness into sharp focus now. Throughout the COVID-19 pandemic, several coronavirus variants have emerged as the virus SARS-CoV-2 continues to mutate and evolve. In November of 2021, a variant of the SARS-CoV-2 emerged that was named OMICRON by the World Health Organization. Even if we have a virus that causes less severe disease, this virus can affect the vulnerable and the unvaccinated population. People with chronic diseases should be careful about management of their conditions during this phase. Diabetes, heart disease, both are leading causes of death in India. And relatively younger adults are getting diagnosed with these serious diseases. Both these chronic illnesses have substantial complications. It is easier to manage the disease if you're aware of the warning signals and problems associated with these conditions. Expert advice will help all of you garner correct information and act accordingly. Joining us on the program today, we've got Dr. Saiyadali, MBBS MD. He's DIAB, CCDIAB, and consultant at diabetologist at Ramdurg Hospital, Diabetes Hospital in Ramdurg. Also with us is Dr. Nikhil. He's MBBS MD, Internal Medicine, consultant physician, GT Memorial Hospital in Nagpur. Thank you both for giving us your time. Let me take the first question to Dr. Saiyadali. Doc, it is said that the new variant is resistant to antibodies developed in people who have been infected with COVID-19 earlier and also from those generated after vaccination. What exactly is the fact here? How much do we know about how much of an antibody escape and immunity escape is actually happening?
Yes, madam. Actually, the newer variants can occur in the people with they have suffered with the COVID-19 and they are already vaccinated. Possibly the mechanism may be because of the to this resistance is the waning of the antibodies which are been already developed by vaccination and by the COVID infection itself. So another mechanism for the resistance of the newer variants is the structural difference in the virus only, as it has got mutated from the previous virus. So what we can tell is the vaccination is the surely helpful in the prevention of the further complications. So vaccination will be helpful surely. So we have to be double vaccinated first, and as it can reduce the severe complications, even it may not be completely prevented, can reduce the severe complications. So people with diabetes and hypertension and elderly, they can go for booster dose, which is soon now it will be available for the public also.
I see. Next question for Dr. Balankhe here. It is quite evident, doctor, that Omicron escapes the immunity generated after the 2 doses of the vaccine. But will 3 doses be able to restore good level of protection? Is it needed to take extra precaution by people, especially who have diabetes, who have heart diseases? Basically trying to understand, even with 2 doses of vaccine, who are, according to you, the most vulnerable lot that need to be careful despite that?
Yeah, there were a lot of speculations to believe that maybe 2 doses may not be sufficient enough to tackle the neutralizing antibody levels, may not be sufficient enough to take care of the Omicron. And it so happened that most of the patients were not doing good with 2 doses because the levels were not sufficient enough. And then we have a study from the Oxford University, which has been published late December, which has very categorically and nicely presented that the 3rd dose or the 3rd jab, which they call as the booster jab, has given us a sufficiently good level of neutralizing antibody. So it's good enough that most of the patients may do good with 2 doses, but then definitive role to play with the booster dose. So if at all there is an someone can have a booster, or at least the healthcare workers can have boosters, they will definitely have a better level of neutralizing antibodies. Same is true with Sputnik vaccine. We may have like with the first study was with AstraZeneca one, the second is with Sputnik. The rest of the vaccines are following their own studies, and we may get results very soon.
I see, but there is still a lot of debate, Dr. Nikhil, about what kind of booster. I just want to understand your sort of view on this. The government has obviously said that they will not be mixing and matching the vaccines. I understand there are papers despite that saying that a cocktail of vaccine actually ends up giving you better immunity than compared to the same dose been given as a third one. If you could take us through some international references as well, countries across the world, they have all mixed and matched vaccines.
Exactly. The world is going forward with mix and match. And the advisory from our government is yet to be there for the booster part of it. Like we have the advisory for the first 2 doses of mix and match in Indian patients. But for the booster part, we have one study which has come from AIG Hyderabad.
All right, seem to have lost that line for a minute there. We'll connect again. Let me, in the meanwhile, go to Dr. Saiyadali. Dr. Saiyadali, the same question to you. Mix and match of vaccines or the same as the third dose? What should be done according to you?
No, presently the available data and match will be as compared to the cross. So it will getting up. It will be helpful for the.
Okay, so we seem to be losing that line there. Let me go back to Dr. Nikhil. I believe you can hear me now. Dr. Nikhil, please go ahead. You were saying about the mix and match.
Mix and match, madam, we have a study from India now, from Hyderabad, for the booster part of it. And they have an excellent result. We will be definitely incorporating those results. And we may very soon have a national advisory to say that we can mix and match. Maybe the third dose can be either of the two, or the third one, whichever is available. But mix and match definitely gives a better neutralizing antibody levels as compared to the same vaccine given thrice.
I see. So amongst the options that are available in India right now between say Covaxin and Covishield, would you say a Covishield for Covaxin and Covaxin for Covishield as a third dose?
Yes, yes. And the Oxford University data for the booster is with Covishield. So if someone has taken Covaxin first 2 doses, maybe Covishield will be a better dose for them, the third one.
I see. I see. I was asking the same question to Dr. Saiyadali. Go ahead, sir. We lost your line over there.
Yes, madam. I will available. Yeah.
Can hear you now, sir. Go ahead. You were talking about the cocktail of vaccines.
Yes, madam. The cocktail of vaccines will be helpful because it may increase the cross immunity, so that what we are getting is the same content of immunity. We can try for the cross immunities. That will be a little bit helpful in the developing still further immunity, so that it can prevent the further complications like lung involvement, like pneumonia. So it may helpful in the, surely it will be helpful.
Okay, so both doctors here saying that actually a mix and match works better, will be better in boosting immunity than just taking the same dose as a third one. Dr. Saiyadali, the next question is about Omicron and symptoms. That is such a focus these days. Is it true that people who are exposed to Omicron appear to get sick faster and may have symptoms that are different from those of, say, other variants?
Yes, madam. The Omicron variant has a little bit highly contagious. So the patients with Omicron positive, they sick faster. And another thing what we have observed till date is they recover faster also. The clinical features may be a little bit itchy throat. Mainly it is a URTI, we can call it upper respiratory tract infection, and a little bit GI symptoms. So as we have seen, and we can tell that till date the newer variants has lesser fatality as compared to the previous variants. You can see the lesser involvement of pneumonic cases, and you can see till date which are the available data is present, the pneumonic incidents are as compared to less with the Delta variant.
I see. I see. Dr. Nikhil, if I can come to you, your read on symptoms as they're emerging of Omicron right now. We understand Omicron ends up sparing the lungs, which is a huge relief. That is what causes less severity, something that we had seen in Delta, of course. But in Delta, for example, we had a very clear telltale sign. If you have loss of smell and taste, you knew instantly that it was Delta and that was COVID. Any particular or peculiar symptom that has emerged from Omicron?
Right now, I think it's still deceptive, and any flu-like symptom can be Omicron. And you'll be surprised to know that so many patients have been coming, out of which almost 30 to 40% are asymptomatic positives. So it is still like the one which we get with Delta, like loss of smell, go and get yourself checked. So these telltale signs are still not there. Definitive signs are not there. It's a deceptive virus. But the good part is right now, at least till today, the presentation is mild and most of the patients are not requiring ICU care. That's a good thing and a very relief for everyone.
Yeah. Dr. Nikhil, one more question before I actually move to, heart diseases and the impact COVID has. Often it is said, and what we are hearing from lots of doctors who are operating ICUs at the moment, is that Omicron leads to something called a scratchy throat. I'm afraid a lot of people don't understand what scratchy throat really is. What does it mean? It's a term that actually was first used in South Africa. That's where the variant was finally discovered for the first time. But since then, we see doctors continue to say scratchy throat, and the differentiator in Delta, you had a sore throat. Now you have a scratchy throat. Could you describe for us what the difference really is?
I think it's very difficult to draw a line between the two. But of course, a bigger part of the sore throat is a scratchy or a scratchy throat. Whatever our people used to say, gale mein kharash. So that kharash, if it becomes more irritating and more painful, you can say it's like Omicron. But then let me tell you that even this is not like the people in our subcontinent are really having very minimal signs and very minuscule, like there are hardly any symptoms to them. They just come with low-grade fever and some irritation in throat. The best part is like they don't have breathlessness, their oxygen saturation is good enough, and that's a relief for everyone. Mostly they have irritation in throat which they are not able to describe.
Right. Gale mein khich as a lot of people say. I think that's a good way to go about
a bigger one.
with a scratchy throat there. Dr. Nikhil, let me take the next question also to you. A lot of viral infections can affect the heart, right? And COVID-19 is no different. Viruses are known to cause inflammation in the heart muscle. Does the virus affect implanted devices in the heart? People who've had pacemakers, stents, etc., do they need to worry?
I don't think people with those implants, either pacemaker or the valves if they have inside, or even any other like AICDs and all. So the virus is not affecting. There is no case report as such till date in last 1.5 to 2 years that virus has affected these. The virus purely affects the muscles. So it's myocarditis or carditis, cardiac failure, which has been described with this virus. But those like involvement of stent or valves or any implantable devices is not yet described. But then those who have these devices inside them, they should be careful because they are the ones who have a higher chance of getting infected.
I see. Good to know that. Next question for Dr. Saiyadali. Diabetes is immune compromised condition, right? Now that the third wave is truly upon us, what tests should people with diabetes do to know the latest about their health, also to ensure that their own health is good, also diabetes is controlled, if that's one is really going for?
Yes. First of all, we should know that the diabetes is an immunocompromised state. We have to monitor it regularly, every 3 to 4 months at least once. And presently in this kind of pandemic situations, we should monitor it regularly. And we should do a regular blood glucose levels testing at least in the house. and we can go for testing like fasting blood sugar level, postprandial blood sugar level at least, and they can monitor in the house only. It is called self monitoring of blood glucose level, and every 3 months they can go for the test like HbA1c, which is the average for the 3 to 4 months of the diabetes control. And if there are any minor fluctuations in the fasting and postprandial levels, they can go for teleconsultation or telemedicine with their doctors, and they can take a consultation in the house only, and they can get medicines to the house only. And upon that, the diabetes people with the diabetes, they should follow the COVID appropriate behavior. They have to follow the all kinds of COVID appropriate behavior like proper social distancing, hand washing, and mask wearing. And upon that, they have to follow the regular diet, yoga, meditation, and exercise as much as possible. So they have to keep fit mentally and even with physically in this kind of pandemic situation.
I see. All right, on that, let's take a quick break. When we come back, we're going to continue with this conversation. Stay tuned. Welcome back. You're watching Health and Wellness Facts and Myths. I'm Sonal Mehrotra Kapoor, and you're in conversation with doctors who are helping us understand how exactly COVID is developing, especially those who have weaker hearts and those with diabetes. Let me take the next question to Dr. Balankhe. Dr. Nikhil, it is a common myth, in fact, that if you have high blood pressure, you experience some unnerving symptoms like dizzy spells. Can high blood pressure be also silently present without any symptoms, and is that likely to damage your heart?
Yes, very much. The people in this subcontinent, they have, unfortunately, they have one of the two, the silent killer or a sweet killer. So hypertension becomes a silent killer for them. And if this BP goes on progressing slowly and gradually, it goes on building up inside the patient, it goes up so slowly that patient starts tolerating it well till it gets manifestations of either a heart attack or a kidney failure or a brain attack, whatever different manifestations of blood pressure are there. So it's not always true, certainly true, that every patient who has blood pressure should have symptoms. These many times the patient goes for an annual checkup and he doesn't know he has blood pressure, and then he comes to know he has a blood pressure, ECG has changes and creatinine has gone up. So this is very much true that blood pressure can manifest without any symptoms. So we need to check it very regularly.
Right. So we need to keep a tap on it, especially if you have a family history, perhaps important to see it. Also, dizziness being seen as one of the symptoms of Omicron as well. So while everybody is getting paranoid, good to get your health checks done pretty regularly. I think that's the way out. Dr. Saiyadali, if I can come to you next. Insulin resistance is a major risk factor for type 2 diabetes. If you could explain to our viewers what exactly is insulin resistance and which age groups have the highest prevalence of insulin resistance.
The insulin resistance means that our body is not able to respond to the present insulin in the body. So it's an impaired response to the body to the present insulin in the body. So when there is an insulin resistance, actually our body cells can't take the glucose inside the cells, so it will add up in the blood, so it will express as a diabetes. So usually we can see 40 to 70 years people can go for insulin resistance because of their sedentary lifestyle, stress, and junk food, and not doing exercises, and little bit family history also. So these are the mainly risk factor for insulin resistance.
I see. Next question to Dr. Nikhil then. How does long-term cardiovascular risk of patients with type 2 diabetes actually compare to non-diabetic patients facing their first sort of myocardial infarction?
Well, diabetes is not good to be there for those patients who are facing myocardial infarction. it has been well documented that diabetes can increase the cardiac risk by 2 to 4 times than usual. If a person doesn't have diabetes, the risk is less than 2 to 4 times. But once you get a diabetes, the risk becomes 4 times more. And apart from getting a risk of heart disease, the extent and the progression of disease is also more exhaustive and extensive. It has been found that if you get myocardial infarction after diabetes, then the number of vessels involved in these patients are more. It's a multi-vessel disease as compared to single vessel disease, which is seen in non-diabetics. This is not a rule, but then it's commonly seen that a diabetic patient doesn't have one single vessel. It usually has multi-vessel involvement. Very rarely you will find a diabetic patient who has myocardial infarction who goes for revascularization. Means either you go for a bypass surgery or an angioplasty. You will find that this revascularization procedure, most of the patients, diabetic patients, require bypass surgery, then an angioplasty. Of course, the decision is made by the treating team, but then 90% of them end up with bypass surgery. So diabetic patients with heart disease have an extensive disease, more mortality, more morbidity. So one golden rule is keep your blood sugars normal every time. Like your blood A1C should be all the time less than 6.5.
Talking about A1C over there, Dr. Saiyadali, if you could answer that, what are the advantages of actually doing HbA1c testing over glucose measurements for diagnosis, which everybody does at home really?
Actually, ma'am, actually the HbA1c level is the long-term indicator for the diabetes mellitus, especially for 3 to 4 months. So it will helpful in the even in the diagnosis of the diabetes initially. By doing the HbA1c test, we can predict the diabetes status, pre-diabetic status. We can predict, and with the HbA1c test, we can plan the treatment protocol, and even the HbA1c level can predict the future complications also. So by doing HbA1c test, we can come to know future complications and proper diagnosis, and we can predict the condition of pre-diabetes, and so it will be helpful surely in the case of diabetes patients.
I see. So, and how often do you think one must go for this specialized test, an A1C test, instead of just checking it at home?
No, every 3 to 4 months you can go for HbA1c testing level. So as it predicts the average of 3 to 4 months, so you can go regularly 3 to 4 months, at least once in the 4 months. So you can go for HbA1c level testing. So it will predict the indicator for at least the average of the 3 months. And the advantage of the HbA1c is, apart from the other glucose testing, is we need not to take any fasting sample. We need not to plan any timed samples. So you can directly go and check the HbA1c level anytime.
All right, so every 3 to 4 months, apart from testing it at home, one must get a A1C test done as well. I'm afraid that's all the time we have. Thank you both for joining us and taking all our questions. This is Health and Wellness, Myths and Facts. We'll see you again tomorrow. Bye-bye.